Hi, this is Sandeep, cardiorespiratory physiotherapist from Singapore. Today I'll tell you a little more about oxygen. We'll talk about how much oxygen do we need, how much a COVID patient needs, where to get this oxygen, and what are the gadgets you may need to provide oxygen. For you, me, who are breathing normal air, the normal air has 21% oxygen. This is what we are breathing. Oxygen is like food to our body, and without that, it's impossible to function. Normal air are Normal air has 21% oxygen. Lungs are fantastic filters. They are able to filter out all the other gases and provide 100% saturation to blood with only this 21% oxygen available in the lungs, available in the atmosphere. That's why we don't ever need supplemental oxygen. Not having oxygen or lack of oxygen can be detrimental. More than 5 minutes of lack of oxygen may lead to death. Why COVID patients need oxygen? This coronavirus causes a specific condition in the lungs. It's called acute respiratory distress syndrome. The alveoli, they get damaged, and because of the damage of alveoli, it's difficult for air to get exchanged between blood vessels and the alveoli in the lungs, and patient gets breathless. In ARDS, you can see there's a fluid collection. This is a simpler way of showing it. Fluid collection in the alveoli. It does not allow gas to exchange. That's why patient needs extra oxygen so that whatever goes into his lungs, he's able to capture it. If you look at the X-ray, on the left is normal X-ray, all dark black, no fluid. On the right side, white patches which depict fluid in the lungs. This is an X-ray of a patient with COVID-19. Not all patients require oxygenation. 81% of the patients with COVID-19 may not need oxygen at all because they have mild symptoms. 14% may because they have 50% or more involvement of the lungs. 5% definitely will because lungs are badly damaged. There are three sources of oxygen. You can have it from oxygen farm in the hospital, oxygen cylinders, and oxygen concentrators. These are the oxygen farm in the hospitals delivering oxygen through the pipes to patients' bedside. 100% pure oxygen can be delivered in hospital. Oxygen cylinders, fantastic way of having oxygen, 100% pure, but expensive, inconvenient because they need refilling and they may last from few hours to a day or two, depending on the capacity and the flow rate you use. Very nice way of getting oxygen is through oxygen concentrators. They generate oxygen from natural air, filter out all other gases, and only provide oxygen from natural air, need electricity to filter, and they provide 93 to 95% oxygen, convenient and cheap. There are two parameters of a concentrator: flow rate, 5 liters or 10 liters, and oxygen saturation. When you each 1 liter of flow rate, it adds 4% of oxygen. So if a patient is on 1 liter flow rate, he adds 4% to 21% already existing what patient is breathing. Patient will get 25% oxygen. At 5 liter flow rate, the patient will get 41% oxygen. So do patients with COVID-19 need 10 liter flow rate? In some cases, yes, but in most cases, no. High flow rate causes dryness of nose. It may cause crusting and bleeding of the inner wall of the nose. Difficult to tolerate, very uncomfortable. Most patients can be managed with 5 liter of flow rate as long as the oxygen concentrator is able to provide pure oxygen and they are of a good quality. Let's look at good and a bad quality concentrator. This is a bad quality concentrator on the left side. You look at oxygen saturation. They do 30 to 90% of oxygen and the flow rate is 9 liters, 2 to 9 liters. This is a good concentrator, 93.3% consistent. Flow rate is though only 0 to 5 liters, but purity of oxygen provided is fantastic. How do we deliver oxygen? That can be another good factors to consider, because you can have oxygen delivered through nasal prongs. This is how the nasal prongs look like. A mask or a non-rebreather mask. I'll talk a lot more about non-rebreather masks. These non-rebreather masks have a reservoir at the bottom. Oxygen concentrators will deliver all the air in this reservoir. There's a flap which opens every time the patient breathes in. When patient breathes out, the flap closes and the reservoir starts to fill in again. This keeps oxygen in the reservoir. Every time patient breathes in, patient gets good quality of air or oxygen in the lungs. So even 5 liter of oxygen concentrator will be able to provide effective oxygen to the patient. How do we measure oxygen? We measure it through pulse oximeter. 95% and above is good. 90 and below, we must be very concerned. 80 and below, patient needs medical intervention. CPAP BiPAPs are the machine which deliver air with a very high flow rate to patient. They should only be used. These should only be used in medical supervision. You shouldn't try and use it by yourself, because it may cause burst of lung called pneumothorax, and it can be detrimental to life. Post-COVID patient will require rehabilitation, because COVID affects more than one particular organ of the body. Patient may require assessment of their exercise capacity, supervised treatment, and a structured program. This is how a program should go, with 6 to 8 weeks and maybe more, and full report should be there after the treatment program. If you need more information on COVID-19 oxygen requirement and on rehabilitation, please contact me at the email given below. Thank you.